Hello, thanks for watching this webinar. My name is Pat Charles. I'm a CPS parent, but also the head of infectious diseases at Austin Health, and talking to you today about the situation with COVID virus. I think it's probably worth prefacing that we're recording this on Tuesday, the 17th of March, and the information with this illness is coming in so quickly that what I'm saying today may not be true in a few days, and things are certainly really shifting very rapidly. So what I plan to cover with this talk is, first of all, what is COVID and the current status? How is it spread? How contagious is it? What are the symptoms of COVID infection? How severe can it get? And what can we do? So first of all, what is COVID? And so looking a bit about, first of all, the origins, and then symptoms and the current status. So I'm sure are aware of this problem starting in the city of Wuhan in China in probably November 2019. Where initially we believe that this started in bats, and probably that's the case with many viruses like this, that it started in bats and spread from that to some other creature, perhaps pangolins or some other reptile, and then from there via the live animal markets in Wuhan to humans. And then initially, after some initial cases of people getting very sick there, spread very rapidly, and both initially in China, but then to the other parts in the world. And you can see the current situation today with the size of the red dots reflecting the numbers of documented cases. Obviously, China and parts of Asia were very heavily affected early on, but now really the epicenter has become Europe, in particular Italy, but countries around that area. What are the symptoms of COVID infection? So for the people that get this, the most common symptom by far is cough and fever. So in the studies that have come out of the places with a lot of these infections, nearly everyone has had a dry cough, and nearly everyone has had a fever. Most of the studies have had over 90% of people having a consistent fever. One study had a lower figure at 70%, but nearly all the others have had a much higher rate of that. So they're the two key symptoms that we're looking out for with this infection. As well as that, it's very common for people to be fatigued and also to have aches and pains, such as aches in your muscles and joints, but also headaches, quite common. Much less common is the standard coldy type symptoms of runny nose, nasal congestion or sore throat. They do happen in a few people, but they're very much in the minority. A few people have had diarrhea as well. Still, the majority of people we're seeing in Melbourne and the rest of Victoria have been travellers, with overseas travel being a key feature. We've had very limited spread here in terms of community-based spread in Victoria, but that's not the case in New South Wales, where that's really starting to take off. If we compare what happens with COVID compared to colds and flu, you can see in this table here, COVID, certainly fever common. You tend not to get one with a cold. Flu also has fever. Fatigue, it's quite common in COVID, not so common in cold, but pretty common in flu. Cough, very common in COVID, not so much in the flu, but also common in flu. Then sneezing is not a feature of COVID or flu, but is in colds. Aches and pains can happen in COVID, but are more common in colds and flu. Runny nose, rare in COVID, whereas more common in colds and occasional in flu. Sore throat, not very common with COVID, common in colds, but not very much in flu. Diarrhea, occasional, not in colds, and not so much in flu, but it sometimes does happen in children with the flu. And headaches, more so in COVID than colds, but much more common in the flu itself. If we look at the situation in Australia now, as of lunchtime today, we're up to 450 cases, and the graph is really starting to accelerate, it looks like. We've had 5 deaths overall, all in patients who are quite elderly. But we're at this point now where the question is, are we going to get on top of this with some strict measures now? And if we do that, maybe we could follow the success stories of places like Singapore, Taiwan, South Korea, and Norway. Or are we going to go the wrong way and have a lot of cases like Iran, Italy, and the United States? If we look at the cases from this morning, you can see that the graph is not looking all that nice in terms of that exponential growth in numbers of cases for the whole of Australia. And it's, as of a few hours ago, it got up to 450. If we look at the overseas versus local transmission, still vast majority are from people who are coming back from overseas, but with this growing number of cases of local transmission, most of which are occurring in New South Wales. If we look at the spread of illnesses across the country, you can see that New South Wales has had the most numbers of cases, but Victoria is about roughly half as many, and with Queensland catching up at the moment too. So moving on to the question of how is COVID spread. So with respiratory viruses, when we look at the means of spread, there's 2 main ways. So The first one, which is the most common, is droplet spread. And what that means is, say I've got the infection, I cough, and you can see in this picture that those droplets come out as you cough, and then I either cough onto my hand or I cough onto surfaces like the table, and then someone else then touches my hand or touches that table, and then they've got the droplets on their hands, which still has viable virus. And we believe that particularly with this COVID virus, that those viruses can stay there for quite a long time, certainly for days it appears like. And then once you've got the virus on your hands, you can then introduce it to your body by touching your eyes, nose, or mouth. And so that's the main way that this is spread. The actual airborne spread, where you inhale the virus directly, is less common, but it does occur mostly with very close contact. We believe that for this to occur, you need to be within a meter, and the closer it is, the more likely, so that you're then coughing and getting those droplets directly into your respiratory tract when you inhale. So the major way of this being spread appears to be this droplet spread, so effectively going via your hands into your body. And then the only way it gets in is via eyes, nose, and mouth. How contagious is it? You've probably heard discussion in the media about this concept of R0, and that's called the basic reproduction value, which for an infection is when you introduce an infection into a completely susceptible population, that you get a certain number of cases being spread from each individual with it. And so if you look at Ebola, the R0 of that was 2, which means that for each case of Ebola, on average, they would pass it on to 2 other people. So you can see in this figure, the first person in blue passed on to 2, and then each of those then passed on to 2. It's not strictly 2 each, that's an average. So you might get one that spreads it on to many more, and then some that don't spread it on to many at all. COVID, the initial figures were looking like probably 2 to 3, but I think we're thinking it might be a bit higher than that, more like 4. And so that each case is then passing on to 4, and so then they'll pass on to 4, and so that is then going to spread to greater numbers more quickly. So whilst we have this basic reproduction value, that's what's called the kind of what happens when you introduce it into a susceptible population and don't do anything about it. However, that is going to vary between countries, so the R0 in one place is not necessarily the same as the R0 in another country, and also once you start making changes, such as the social distancing and the isolation, you then do change that. So you have an effective R0, which is different to your basic R0. How severe is COVID? So again, this is a commonly seen thing on social media at the moment, that the majority of cases are mild. And so that's what typically happens with those ones is for about 5 or 6 days, they have fever, dry cough, some of the aches and pains, feeling tired, and then stay like that for that time and then start to feel better around about a week into the illness and then recover. But there's those other ones that do go into the severe or the critical, i.e. needing intensive care type treatment. So that makes up about 20% overall, with about 5% being those critical ones. What is a bit concerning with those is they have the same initial phase where they have that 5 to 6 days of feeling those sort of general flu-y type symptoms with the fever and the dry cough, but after they have an initial feeling of, oh, maybe I'm starting to get better now, that's when they then suddenly deteriorate much more rapidly and go into what we call respiratory failure, where they're very short of breath and have very low oxygen levels in their blood. So the risk of these more severe cases does depend on age, and fortunately for parents, kids seem to be relatively protected from this and do not seem to get severe infections much at all. In fact, there's even a theory that maybe kids aren't getting infected much at all. Normally, with most respiratory viruses, we worry about kids being the spreaders, even though they don't get particularly sick. But in this one, it might be a bit of an exception to the rule. There's a biological explanation for this, that when the virus gets into your body, it goes in through what's called the ACE2 receptor. And that's not expressed in babies, and it doesn't really get much expression until you hit late teens at least. So it's possible that kids are not really getting much infection with this, and so therefore they may be not the major vector of this kind of viral infection. So you can see that in the young there's very few severe infections and the mortality is very low, whereas once you get up to the over 80s, then the chance of dying then is about 1 in 6. So it's very concerning if the elderly do get exposed to this infection. So a bit more on this detail about do kids get these infections? So if we look at the red bars from Korea, where they've done the most amount of screening, it looks like in that 0 to 9 year age group, there's very few infections. And this is despite a lot of kids getting tested. And even then you go to the 10 to 19 age, there's only a small number of infections. And what's also notable is whilst you can find the virus in these kids by doing a swab, they're not having many symptoms, if any. And so probably part of the contagiousness of this infection relates to your coughing, and then you're spreading the virus onto surfaces, and so that droplet spread occurring from there. So if kids are getting these infections in small numbers, but they're not actually getting many symptoms at all, they may not be spreading things much into other people. And so it would require kind of direct contact with their saliva to be at any risk at all. And so certainly kissing or sharing drink bottles would be a risk in that situation. But it may be that the kids don't spread it so much like adults do. And some of the patients we've seen in hospital now with this, they are coughing a lot. And so you can certainly see that the degree to which they're coughing, they're going to be covering all the surfaces in the area with lots of those droplets. So can we do anything to stop COVID? So, well, yes, we can. We believe that certainly things we can do. We need to try and drop that R0 down to less than 4, and ideally, if we can get the R0 to below, the effective R0 below 1, then we can get rid of this infection. Now, we've heard a lot in the media recently about flattening the curve, where if we did nothing and let this spread unchecked, we would eventually get the number of people infected in the community that would then stop this spreading, but that would require probably about 70% of people to get that. And so if we then look at the numbers of serious cases in that would be huge, and that would overwhelm the healthcare system capacity. And certainly in places like Iran and Italy and parts of the US now, they're seeing that happen, where huge numbers of people are coming to hospital. The intensive care unit, they can't keep up, and they're effectively having to choose between which patient they can take there to look after their low oxygen levels, and which ones they have to say, I'm sorry, we just can't afford to take you because we just don't have the spare room or the spare beds or the spare ventilators. So if we can lower the effective R0, slow the spread down, what we then hope is that we'll probably have the same number of infections and maybe need 70 or so % of the population to get infected to break this epidemic cycle. But if we can do it over a much longer time period, then we can have this situation where we're not going to have the health system overloaded. And the concern is if we do overload that system, that then people coming in with other problems, which obviously will still occur, they might have something that's relatively treatable, but if they just can't even get into the hospital, then people might even end up dying from other things that are actually very treatable. So what can be done? At the governmental level, there's the issue of social distancing, and so particularly this issue of mass gatherings, and how we define mass gatherings is changing. We've just heard recently the government's saying that we need to have anything more than 500 people stopped, but I think in reality it needs to be a whole lot more strict than that. So I think it's time for us to say, all right, well, we need to really restrict these social gatherings. And I know some of the doctors at work who are planning to get married are already cancelling their weddings for the time being. And we're not going to restaurants. We're really sort of making a concerted effort to really stop this social contact to try and prevent the spread of this infection. So the other things we can do at the governmental level is isolating cases. So to do this, we need to test and find the cases, which unfortunately is a little bit challenging at the moment because of limited resources available to do the testing. In particular, just the actual swabs that we put in people's noses to take the test, we're running out of those very quickly. And once we run out of those, we kind of can then go to some older style swabs, which are not quite as accurate, but we can still use them. And then the actual test, what's called PCR tests, the supplies required to do those are also in quite limited supply. So the testing we're doing here is very different to what's being done in other places like South Korea, where they're effectively testing everyone, but we're just not going to be able to do that just through a limitation of some of the practical things required for the testing process. So people with consistent symptoms, we're just going to have to isolate, and mostly that'll be at home. If they're sick enough, obviously we'll then be in hospital. In addition, we do need to reduce other viral infections like the flu. So the flu vaccine will probably be released early this year, so late March, early April, and I think it'll be very important to get that. Hopefully we have a better year this year than the last year or two with flu, because if we do the social isolation, there should be fewer cases of the flu anyway. And if we get people vaccinated, then that will hopefully reduce that further. It might be, though, that because the flu vaccine, which is not a great vaccine at the best of times and maybe giving 60 or 70% protection, and for a short time, if we do it early, such as late March, early April, by the time that we're into winter period of July or so, we might need to revaccinate people at higher risk because that immunity is relatively short term with the flu vaccine. At the family and personal level, So the most important thing is assume that you have the virus on your hands. So if you have been anywhere outside, if you've touched your phone, if you've touched anyone else, if you've touched any surfaces, assume you've got the virus on your hands and then wash hands. And hopefully some of the children have been going through some classes on that this week. But just a reminder to do this properly, wet hands first, then put soap on your hands, then rub your hands all over, back and front for 20 seconds. So that's 2 verses of happy birthday. Then once you've done that, then wash your hands, rinse off your hands and then dry them. And so if you do have hand hygiene type rubs, so the alcohol-based hand hygiene rubs, they're okay, but make sure they do have at least 60% alcohol in them, because some of the ones that are sold at the moment are not having 60% alcohol, and we have only done tests to show that 60% or more of alcohol will kill the virus. So then there's the issue of cough etiquette. And so first of all, if you do need to cough or sneeze, although not that we think sneezing is a common feature of this, can you do it with either, first of all, with a tissue would be better, and then disposing of the tissue. That's preferable to a handkerchief. Or if you don't have a tissue on you, then coughing into your elbow, and then once you've done that, then washing your hands as per the previous slide. So then certainly there's the issue of surfaces on top of that. And so if you're then cleaning surfaces around the house, or if you happen to have someone isolated at your house and you're giving them things like a tray of food and then wanting to wash the surface afterwards, then things like anything with alcohol more than 60%, or any type of bleach or anything with peroxide will kill the virus. So we believe that certainly detergent is going to be effective as well, but we haven't got as many studies on that, but there's no reason to think that detergent wouldn't be effective as well. Social distancing. So I think it's time for us to all make a bit more of a sacrifice with this, in terms of saying, all right, well, no gatherings of more than 10 people, no restaurants, no parties. And we really need to do this, because if we get it wrong, we're really going to regret it. Hopefully we can get to the end of this and say, well, we overreacted, but that's good, because we may not get to the levels of disaster that some places have hit with this. So there's, just in terms of semantics, the difference between quarantine and self-isolation. So if you happen to have been exposed to a likely case or a definite case, or if you've come back from overseas, and so that you may have been exposed overseas, we put you in quarantine. The duration of quarantine is 14 days, because we think that's probably about as long as the incubation period for this infection can be. So the time between being exposed and getting your first symptom, up to 2 weeks. So if you're in quarantine, then you're at home doing nothing for that 14 days. And so you can have no windows open, and but it really you're on your own. You're not having direct physical contact with other people in the house. If you say have the illness and you're one of the people who has just a mild dose of this, then you're in self-isolation. So self-isolation is for people with it, quarantine for people who've been possibly exposed to it. Self-isolation, at the moment, what we believe from some developing studies on this, is that you're infectious from probably 2 days before your first symptom till roughly 7 days into the illness, if you're one of those people who's going to get better, assuming you're not one of the people who gets very sick. So in that time, so in those first 2 days, obviously you don't know you're going to have it, but we can find the virus by testing your nose swabs or throat swabs in that time. So probably your saliva is contagious at the time. Then once you've got the cough, then we know you're very contagious for those first 5-6 days. And that's really probably the most worrying time for the spread of the infection. Then the studies now where people start to feel better. Once they've felt better for 2 days and had no fever for a day, at that stage, people are not able to culture the virus anymore. And so we believe that's probably the time where they're no longer contagious. For the people that get very sick, they're probably contagious for longer. One of the questions is, do masks help? The best role for masks is for people who have the infection, to stop them spreading those droplets onto all the surfaces around them. For protecting yourself before you've got the infection, there's probably not a whole lot of role for masks. And in fact, with the SARS outbreak in 2003, in some of the parts of Asia where they had a lot of cases, there was some suggestion that maybe masks even caused a few extra cases, because people feel quite uncomfortable having a mask on for a long time and end up fiddling with it, and possibly then with dirty hands with the virus on it can then introduce the mask to their face that way. So we're certainly not encouraging masks for just regular street contact with this condition. There's the issue also of travel plans for the holidays, and from personal experience, we've just cancelled all ours, and so we're not going to be travelling, certainly not interstate or overseas, and we might just do some driving around Victoria, but nothing more than that. And so we're really doing things just very much isolating ourselves to try and avoid that social gatherings that might facilitate the spread of this infection. We're hoping that being healthy, that we're not really the ones at risk, and particularly our kids are not the ones at risk, but for every time that someone does get this, they can then pass this on to someone else who may be more vulnerable, and certainly those people would be the older patients, or older people, or people who've got weakened immune systems. So anyone who's had any form of cancer treatment in the past seems to be high risk. People with bad lung disease or bad heart disease certainly seem to be high risk. People with diabetes and other forms of weakened immune system. And so those people, we really want to prevent them from being exposed to this. And so even if kids and adults, young adults, are not likely to get very sick, if we can stop them getting it, we can then reduce the spread to those people who are going to be more at risk. So thank you very much for listening, and we'll be now taking this tomorrow night on Wednesday to a webinar to try and answer some questions if people do have some questions on this. So thank you very much for listening.